My opinion is that people in the future are going to look back at this whole folly in our society, as I think it is, of trying to treat people for psychological and spiritual problems with medication. Talk about suicide is always to be taken seriously. There's nothing the people left behind could have done. That's the reality. The fact that we couldn't have done anything is so alarming and distressing to us on a deep level that we would rather believe that there was something that we could have done. One thing you learn in psychiatry very quickly is that you're not going to prevent anybody from committing suicide if they're determined to do it. People who are contemplating suicide are often not in their rational mind. If you try to approach a person who's having a major depressive episode with reason, they're not going to be able to respond, because the essence of a mental illness is that they're not rational anyways. You can't reason people out of suicide thoughts. One of the most important aspects of recovery from this sort of horrendous trauma is talking about it. Suicidal thought is just a common thing among human beings. Sometimes people with various kinds of physical illnesses will kill themselves. Suicide is contagious. There's no doubt about it. I've had quite a bit of experience over the years talking with people who had their near-death experience as a result of a suicide attempt. The near-death experiences of people who attempted suicide are no different at all in their content from the experiences of people who come close to death for some other cause. In the cases of those who have been interviewed who attempted suicide, almost died, and were interviewed and did not have a near-death experience, when those people are followed over a period of time, they continue to have a high rate of subsequent attempts to kill themselves. The patients who attempted suicide almost died but were revived and did have a near-death experience. When those are followed over a period of time, there's an essentially zero rate of any further attempts at killing themselves. Personally, I just don't buy it, that God has a special grudge against suicide attempters. I just don't think you're going to make people who are severely depressed any less likely to commit suicide by making them terrified that they're going to be in a hell when, from their point of view, they're in a hell already. Always take suicidal ideation seriously. Always.